COVID-19 infections spiking across the country as New York is also dealing with an increasing monkeypox outbreak. What healthcare experts are saying about these dual threats and the latest on the efforts to protect New Yorkers. Hello and welcome to Empire State Weekly. I am Sullivan in Albany. Well, New York is continuing its response to these ongoing health concerns. Governor Kathy Hochul recently announcing the state will outfit schools with 3 million COVID test kits ahead of the upcoming year to test students and staff before classes begin. And when it comes to the monkeypox, the state's health commissioner declaring an outbreak of a, quote, imminent threat to the public health. The state now giving an additional set of funding to local health departments already combating the spread of the virus and also securing an additional 60,000 doses of the vaccine. Now, at the same time, the number of new monkeypox cases continues to grow. The nation now at over 4,000 confirmed cases, most of them in New York, specifically in New York City. This week, the World Health Organization declaring the outbreak a global health emergency of international concern. Only COVID and polio receiving that designation as well. Counties across the state, in the city, Long Island, and upstate in Saratoga County, continuing the rollout of vaccines to try to slow the spread of the virus. Now let's get up to date on the latest COVID numbers as well. Here is this week's transmission data from the CDC. Most of the country currently in orange. That means there are higher infection rates. Here in New York, meanwhile, only New York City and Long Island seeing high transmission rates, while most of the rest of the state, that includes the capital region, central and western New York, and the southern tier, seeing low transmission rates. As you can see there, though, in yellow, there are some pockets in each area that is seeing medium transmission at this time. And joining us now to talk about where things stand as the state addresses these two health emergencies is Dr. Arthur Grant, an infectious disease specialist at Samaritan Hospital. Doctor, we appreciate your time. We'll get right into it. How challenging is it to manage both of these situations at the same time?
The situations of monkeypox and COVID, it's certainly a challenge on the health system and on providers, as well as on people in the community who are worried about these diseases. Monkeypox is something new for most people. We did see an outbreak about 20 years ago associated with animal exposure. It was in prairie dogs, and now we're seeing a somewhat different outbreak, which is associated with person-to-person transmission on a larger scale. So it is a new challenge for us, and of course, COVID remains a significant disease in the community, and there have been a reasonable number of cases over the last few months. So it is a challenge on our health system to deal with these two diseases at once.
Now, there are some who say the state and the country has been slow to react to the monkeypox. Is that the case, or is the health community taking what it learned from the COVID response to better tailor a response to this particular virus?
I think we've all learned a lot over the last couple of years with our COVID response. I think we're taking monkeypox seriously. I know that on the research front, we've definitely been working on things with treatment modalities and ramping up our access to vaccination to prevent monkeypox spread within the community, as well as dissemination of information to people who are at risk, at highest risk for contracting this virus. So I think we've done a reasonable job as a system. I'm hoping we've learned some lessons from COVID. I think that everybody will eventually.
Let's get into the threat from monkeypox. This, of course, a little bit different than COVID in that you really need that person-to-person contact. How important is it for the public to be aware of the threat here?
The public should be aware that it's out there, but most populations of people remain at extremely low risk. This is a disease that's transmitted through close and intimate contact between people, and casual transmission is really not a main risk factor for contracting monkeypox. We have to be careful about it with regards to its main transmission.
Now, what about vaccines? You mentioned that monkeypox vaccines have been refined and ready for years now. Is this a situation where it should be distributed more widely and faster than it is right now, given that these vaccines have been developed and they are sitting there?
Well, The vaccine that is developed is actually vaccinia, and that is the first vaccine that dates back to the 1700s when Dr. Jenner first inoculated people with his sick milkmaid who got sick from Blossom the cow, and we even remember the cow's name. So this is our vaccine that protects against smallpox, which is a much more dangerous disease, but fortunately has been eradicated for the last 50 years, for the last 40 years. So we have stockpiles of vaccine because of our concern of smallpox as a potential bioterrorism organism or an accidental outbreak. It does offer protection against monkeypox, which is great, but it's in limited supply, and the ability to just ramp up production on a quick level is not always so easy. So we are using our supply to vaccinate people who are at high risk, but it is something that's going to take some time.
Doctor, the socio-political implications of this, monkeypox, of course, can infect anyone, but you talked about the populations that may be at greater risk. It is spreading faster among men whose preference is to engage in intercourse with other men. As a physician, how do you provide treatment while also not making potential patients feel stigmatized?
Sure. Well, that's always a problem with sexually transmitted diseases. That was certainly a problem early in the AIDS epidemic when we saw higher numbers in gay men population. But of course, as we know, the trajectory of HIV was that it ended up being a disease that anybody could get. So yeah, we have to be careful about that, but we also have to dedicate our energies to informing and educating this particular population who is at high risk. And because that is where we are seeing it right now. It's essentially exclusively in men, and it's almost overwhelmingly exclusive in that population of men. So we need to focus our energies on that population if we're going to try to stop the spread at this time.
Before we wrap, COVID, of course, still a threat, as I mentioned. The virus, though, does not seem to be nearly as deadly as it was early in the pandemic. We are still seeing some areas of medium and high transmission in New York State. From your perspective, are you still worried about it? What should folks at home be doing to protect themselves?
I think we have to continue to be vigilant about COVID just because we are continuing to see a lot of cases. You're correct that the disease is not nearly as deadly as it was in the past, and that's a wonderful thing. But there are still a reasonable amount of local spread. And of course, COVID is much, much, much more contagious person to person than monkeypox. So that does remain the main concern for most people who are at reasonable risk just because of interaction with other people. So we have to stay vigilant about COVID, and people who should get people should get vaccinated. People who qualify should get their boosters, and we should continue to take reasonable protections to try to avoid illness.
And one quick follow-up here. In the past, we've seen these surges happen in the fall with the new Omicron subvariant BA2. We're seeing a bit of a surge and an uptick now in the summer. Could that mean we may be in a better spot come fall and winter? Does it really not matter?
Hard to say, because we see a lot of people who have had COVID previously or who have been vaccinated for COVID previously are still getting sick. So the surges are not going to be mediated all that well by our vaccination and by our prior infections. So we're not really sure where we're going to see these surges in the future. It's hard to tell.
Dr. Arthur Grant, we really appreciate your time today. Very important topics. Thank you so much.
You're welcome.
All right, coming up, we are going to turn from physical to mental health concerns. How New York is hoping to support a new national suicide prevention lifeline with additional resources to get treatment to those who need it most. Meanwhile, if you have a comment or story idea, we'd love to hear it. You can email Empire State Weekly, or you can find us on Twitter. And welcome back to Empire State Weekly. I am Solomon Syed in Albany. The COVID-19 pandemic has highlighted the challenges many are facing regarding their mental health and also how to access resources to treat it. And whether it be increased awareness, the medical community improving the way it diagnoses conditions, or a combination of that. Experts say it is driving a number of growing issues, including an increase in drug overdoses, suicides, and more. Let's get a look at some key statistics here. According to the National Alliance on Mental Illness, 21% of adults experienced mental illness in 2020. That is 53 million people, and certain groups are being hit harder than others. Mixed or multi-ethnic Americans report suffering at a 35.8% rate. Black Americans, 17.3%. White Americans at a rate of 22.6%. And those in the LGBTQ community, 47.4%. Digging a little bit deeper, according to the CDC, 37% of high school students reported poor mental health during the pandemic. 44% say they have persistently felt sad or hopeless during the past year. Well, a new National Suicide Prevention Lifeline 988 has been launched to get immediate access to mental health support to those who are in crisis. We're pleased to be joined right now by the State Office of Mental Health Commissioner, Dr. Anne-Marie Sullivan. Commissioner, to talk more about how the agency's vision for this lifeline goes way beyond just a phone number. Is that right?
Oh, absolutely. I think it offers, first of all, it offers that easy access, 988. Anyone can call. It can be a big crisis or just a small question. People can call because they're concerned about a loved one who maybe is using drugs or substance use. They can call if they're feeling depressed. They can call if they're feeling like self-harm. And they can also call if they're concerned about their youth, their child, who maybe is having some difficulties in school. So the crisis line is there really for anyone to call about any mental health issue. And it's a counselor on the line. So the counselor will be there, a live person, to speak with you about whatever the issue is. Now, for some individuals, they may need a referral to other services. And that's relative to what you were mentioning, that we've also been building a whole system of crisis care, which includes mobile crisis outreach teams and crisis stabilization centers. And we will be opening up across the state 12 intensive crisis stabilization centers early next year. And those centers will be welcoming anyone with either mental health issues or substance use issues to come in and get help across the lifespan, youth all the way to adults. 24/7 availability.
Now, I want to get to those centers in just a moment, but so far, the 988 Lifeline, how has the launch gone so far? You're talking about expanding some of those statewide supports and services to back up this national initiative.
Yeah, well, so far, we used to get approximately 430, 450 calls a day. Since the launch, we're getting 650 plus calls a day. So that's about a 50% increase. And we're expecting that those calls will probably go up to, and continue to increase over the year. But we're ready for it. We have expanded our call centers across the state, and so far we are able to definitely handle the volume and handle more volume. And then similarly, these services that we're going to be putting up will also help to provide individuals who need a referral from the Lifeline. Only about 80 to 85% of calls are handled right there on the Lifeline, but then there's a 10 to 15% that may need a referral to future services, which we're putting up across the state.
So this Lifeline really digging deeper into the treatments that folks need. You talked about these mental health concerns going beyond just suicide. It's being blamed for an increase in drug abuse. And you talked about it, $75 million set aside for what is being called intensive crisis stabilization centers. What is the timeline for those? You mentioned that they're going to be opening up across the state. What do you envision in terms of staffing and services there?
The timeline, we have awarded 9 of the centers. We have 3 more to award the dollars for. And so we're very hopeful that they should be up by early next year. And the staffing in the intensive centers will include peers, individuals of lived experience. It will include social workers, psychologists. It will include substance use specialists. It will include psychiatrists, medical, and it will include RNs and or nurse practitioners. So basically, it's a good full staffing of individuals for whatever the issue is that you may be bringing to the stabilization center. The plan is for people to spend probably up to 23 hours. If they need services more than that acutely, then they will be referred to some of the other services we have, like crisis residence residences, which are coming up across the state, or to aftercare in a clinic, or to whatever is needed. But these services are 24/7 immediate access. So when you walk in, you will see someone right away.
Now, Dr. Sullivan, there's also funding for mobile crisis centers. Is that the future of mental health treatment, meeting people right at the source of their issues, not just waiting for them to seek help?
Absolutely. And I think, we want to grow increasingly the community-based services where individuals can get help when and where they need it. So mobile crisis teams are individuals who go out and meet you, whether it's at the home, they can meet in a coffee shop, they could meet on a street corner. They can meet you when and where you need those services, and they can come out to see you there. The future is really community-based care, all the way from sometimes just counseling, all the way to intensive services.
Dr. Sullivan, before we wrap up, what else needs to be done to meet this crisis? It's really been exposed during the pandemic. What else needs to be done?
I think we need to make sure that the entire mental health system is supported in a really robust way. So that means all the I don't mean downstream services, things like clinics, things like some of our housing for individuals who need housing. Multiple services have to be strengthened. But we also have to be out there to talk to everyday New Yorkers who are just experiencing this post-pandemic. And that's why this particular 988 number is so important, because you can just call with simple concerns and simple worries as well. And then the other issue is growing our workforce. And we are really working very hard to grow the workforce. In this year's budget, the governor gave us a 5.4% COLA. We are also working with universities and colleges to help us get more workforce in, because we do know there's a national workforce shortage. And we're $9 million we received for loan forgiveness for psychiatrists and nurse practitioners, which will be going across the state to help us with the manpower shortage. So I think it's a combination of making sure that we have all the services we need, but also that we have the workforce that can really provide those services to New Yorkers.
And Dr. Sullivan, the Commissioner of the Office of Mental Health, we appreciate your time today. Thank you so much.
Thank you.
All right, up next, New York is aiming to expand rights and opportunities for those who face unique barriers. How a new package of bills, 3 decades in the making, looks to enhance equality in some key ways. And if you have a comment or story idea, please let us know. You could email Empire State Weekly, and you could also find us on Twitter. And welcome back to Empire State Weekly. I'm Solomon Syed in Albany. Well, this week is marking 32 years since the American with Disabilities Act was signed into law, prohibiting discrimination against people with disabilities. Capitol correspondent Emil Taligi has the latest on a package of bills signed this week looking to build on those principles and expand equal rights.
And I remember what it was like pre-ADA, when there were no accessible entrances and bathrooms were not accessible. It was an entirely different world, to live as a person with a disability back then.
One of the bills signed into law will create a public awareness campaign to combat stereotypes for people with disabilities. The sponsor of this bill is Senator John Mannion. He says the campaign will work through media and social media.
And individuals with disabilities and their family members, there are moments, certainly almost every day, where they realize that that stigma certainly still exists and barriers still exist.
Senator Mannion says in some cases, a person deemed disabled must give up their rights to make decisions, and the responsibility is on the guardianship. Another bill he sponsored will give more flexibility to those with disabilities when it comes to decision making. And
allows for genuine input by the individual that has disabilities without basically passing over all of their rights. So this is certainly an improvement. It's more inclusive and it's least restrictive.
This situation may sound familiar for some Oops, I Did It Again fans.
Britney Spears situation, and people were surprised that she actually did not have control over many of the things that were happening in her life, where, when it came to a variety of different things.
The senator says Britney's fan club is a big supporter of this bill. Reporting in Albany, Emil Taligi.
All right, thank you, Emil. Meanwhile, New York State is also taking steps to make child care more accessible. Nearly $70 million in federal COVID relief funding is going to new child care programs in underserved areas of the state. Some experts say making child care more affordable will also help solve ongoing worker shortages. Nearly 2 million women have left the workforce during the pandemic to take care of their children.
I said, people aren't coming back to work because there's no one taking care of the kids. Imagine if the kids were taken care of at the place of work, in a nurturing environment with trained professionals.
Officials also expanding child care subsidies, which will make more families eligible for financial assistance. All right, stay with us. We have a look at the week ahead coming up after one more quick break. In the meantime, if you have a comment or story idea, let us know. You can email Empire State Weekly, and you can also find us on Twitter. And finally, on Empire State Weekly, we are keeping an eye on how the CHIPS and Science bill that passed in the U.S. Senate and the House this week could have a major impact here in New York. The bill invests $280 billion towards encouraging semiconductor manufacturers to expand operations in America. This, of course, at a time when the world is facing a global chip shortage. And for now, from all of us here at Empire State Weekly, I am Sullivan Syed in Albany. We'll be seeing you again next week. And don't forget, you can watch Empire State Weekly all over New York State. Here is the full schedule of Empire State Weekly on 10 television stations across New York.